Now that Pfizer's COVID vaccine has been officially green-lighted for kids ages 5 to 11, we're taking your questions about the safety and effectiveness to our Health Insider. Dr. Shad Marvasti is joining us to answer your questions this morning. Thanks for being here, Dr. Shad. Let's dive right in. First, logistics. Do kids need 2 doses like adults, and are they likely to see any side effects right afterwards?
So it will be kind of the same time frame in terms of the 2 doses, but the doses are going to be much lower comparative to the adult dosing. The second dose is the one in the trials and also as seen in adults, where you're going to see more of the typical side effects of fever, fatigue, headache, all those kind of general symptoms associated with getting a vaccine, which are really common symptoms that happen with any vaccine actually received in childhood. So no difference here. That's basically the process of your body building immunity and building and creating those antibodies to protect you against the virus.
This has been a big concern and maybe a misconception circulating. Will the vaccine affect a child's future fertility?
While we've never studied this to look long-term, obviously, to see that, what we know from adults, in fact, that the vaccine doesn't impact fertility, but COVID itself can impact fertility. I would say that the risk of COVID infection in childhood potentially impacting fertility is theoretically much higher than the risk of the vaccine in terms of what we've seen in adults.
One thing we do have some data on is the risk of myocarditis, heart inflammation. So as a parent, should I be concerned about myocarditis, particularly showing up in my young boys?
The risk is definitely higher in adolescents, and most likely in children will be a little bit higher, but it's still, even when we say higher, it's a very rare side effect. And it's also one of those side effects that's pretty easily resolved with anti-inflammatory medications and just a tincture of time.
So bottom line, you're more likely to get COVID-19 than a side effect from the vaccine?
Absolutely. If you look at the risks in terms of that, they now can get it and transmit it just as easily as adults. And so the risk of getting COVID and then the possibilities there, depending on if they get long COVID or if they get sick to the point of being hospitalized, that's not something you want to, take on, as opposed to the potential risk of rare side effect of myocarditis, which is much less of a risk as compared to the real and present risk of getting COVID.
More questions from parents. Should a child with pre-existing conditions get vaccinated now or wait?
Absolutely. If you have a pre-existing condition, like a chronic medical condition, those children are actually the highest risk. So they actually should prioritize getting vaccinated as soon as possible. If the condition is a severe allergic syndrome, that's something you want to talk to your doctor about.
And last one for you, Dr. Shad. If a child has already had COVID and recovered, do they need to get vaccinated?
I think it's the same concept as adults there. We see that in adults, there's 10 times more immunity with the vaccine, and also helps to prevent recurrent infections. Recurrent infections can and do happen in adolescents, can also happen in children. Now that we're seeing it with the Delta variant 6 months from now, I imagine kids who've had the Delta variant of COVID, if they don't get vaccinated, they will be at higher risk for whatever variant is circulating at that time, versus if they get vaccinated, they'll be protected.
Our Health Insider working to get you the facts. We thank you for your time, Dr. Shad.
Of course. Yeah, my pleasure.